If we just have a snapshot of the Kenya situation, and this is based on WHO 2011 data, high blood pressure has been associated with deaths that has reached 2,845, which translates to 0.9% of the total deaths. I know some of us would say perhaps this is an underestimation. It's likely to be more than this. But the same has been associated with age-adjusted death rate of 21.1 per 100,000 of population, ranking Kenya number 121 in the world. So you can see the impact of high blood pressure in our population. Stroke has been associated with 15,399 deaths in the country, translating to 4.85% of the total deaths, with age-adjusted death rate of 116.62 per 100,000, which puts us in a position of 75 in the world. Coronary heart disease estimated to cause 13,488 deaths, or 4.25% of total deaths. This being just a snapshot of our situation, I think we can see the impact of high blood pressure and its related conditions in the country. Again, I know there is definition of hypertension in the brochures you have on the table, but I just wanted to emphasize that hypertension also means high blood pressure, and it's one of the proven modifiable and preventable cardiovascular risk factor worldwide. Why I want to emphasize this, we want to understand that high blood pressure is a risk factor that is modifiable, associated with our behavior of lifestyle, and that means if we do something on it, we can change the trend. So the treatment of hypertension will prevent cardiovascular diseases, definitely to extend our life, prolong our life, improve the quality of our life, but it is evident that there is inadequate management of hypertension worldwide, and more so in developing countries. And we need to understand that hypertension, being a risk factor, can lead to coronary heart disease, heart failure, stroke, kidney failure, vision impairment, among others. It's just a small list of what can be caused by hypertension. And of course, we know the impact of high blood pressure with its related complication on the level of poverty in our country, and also hinders economic development. We also need to emphasize that hypertension, which has been actually emphasized by the group that was here ahead of me, I would say is dangerous. And that's why I'm saying it's a silent killer. One may have no signs or symptoms, meaning one would say, I have no reason to go and determine or get my blood pressure measured. What happens if one does not know this, and the blood pressure is there, over years it leads to progressive damage to most of the organs in the body, heart, blood vessels, kidneys, meaning majority, and that's why we say majority of the people presenting, when they have already damage to these organs, they present either in stroke or they prevent even when they have heart attacks. So what is the solution? We need to know our blood pressure, even when we feel that perhaps we are fine. Again, because there are no signs and symptoms. If one blood pressure is found to be normal, then we recommend that you work with the health team, you get support to keep your blood pressure within normal. If it's found to be high, then interventions are put in place, treatment to prevent further damage to body organs. These are some of the modifiable risk factors associated with high blood pressure. Consumption of unhealthy diet. It has been emphasized here: excessive salt intake, food high in saturated fats, refined foods, among others. Physical inactivity, sedentary work or lifestyle, increased use of motorized transport, which has been emphasized, declining opportunities for physical activity, that's walking or manual work. So we have been, we really recommend that physical activity is very important, and as it has just been put here, at least 30 minutes of perhaps aerobic physical activity per day will really reduce the risk of getting high blood pressure. Other modifiable or behavioral risk factors: harmful use of alcohol, that is high volume consumption of alcohol, excessive or binge drinking, tobacco use, which actually I know that sometimes we tend to assume that it contributes highly to getting high blood pressure. Stress-related factors and other determinants, social determinants. We need to emphasize that there are other social determinants also that will lead to high blood pressure. We look at our, the urban planning, transport system. Again, motorized transport. We hardly walk nowadays, and one would say perhaps where there are no walking paths, but even where they are, we need to change our behavior so that we are able to engage ourselves in physical activity. Our health system, policy orientation and services also perhaps would contribute to that. Why that is because we need to embrace the concept of well-being health care, where one can walk in and being done a medical checkup, not going to the clinician or to the hospital when one is sick. Now, what do we gain by adopting a healthy lifestyle in relation to high blood pressure? Definitely, we reduce the high blood pressure. We prevent and delay the development of high blood pressure. We enhance the effectiveness of blood pressure medication. This goes to those people who are already on treatment for high blood pressure, that adopting a healthy lifestyle, as I've mentioned, will enhance the effectiveness of the management put. It lowers also the risk of heart attack, heart disease, stroke, and kidneys disease. And this has been indicated in some of the research where serum cholesterol less than 200 milligrams per deciliter, with a normal blood pressure less than 120, 180, and where no cigarette consumption has actually contributed to 72 to 86% lowering mortality from the cardiovascular diseases. So this is a very important thing to note, that if we adopt healthy lifestyle, we reduce the risk of developing CVDs. Is high blood pressure preventable or manageable? And I think that is what we really need to understand. I'll just summarize by saying, yes, it is. It's preventable, it's manageable, and we look forward by doing a lifestyle prescription in addition to any medical prescription given. I know you bear me witness that the combination of lifestyle prescription and medical prescription will have a better outcome of an individual with high blood pressure. What we recommend is reduce salt intake, which has been emphasized here. I know a lot of retail will give different figures, but for a case, I guess I would recommend 1,500 milligrams of sodium per day. That is including packaged or prepared foods salt that is in. I know the American figures are different, but this is what is recommended. Maintaining a healthy weight. Again, sustaining weight loss of 4.5 kilograms have been found to reduce blood pressures by 5 millimeters per mercury of, that is systolic, 5, 7 diastolic. Then there is also a recommendation of regular aerobic physical activity. For example, brisk walking. Many times we think that we need to go for gym for us to be seen to be doing physical activity. But what our recommendation is, even brisk walking, at least 30 minutes per day, in most of the days, will be very important to our health. Not forgetting also maintaining a healthy weight. Avoiding tobacco use. I will not emphasize that. Limit alcohol consumption. Adherence to medication. This actually will also delay the onset of complications associated with high blood pressure. Diet, we recommend rich in fruits, vegetables, and low content of saturated and total fat products, which is also considered to be DASH eating plan. What does prevention entail? It's cost effective to target people who do not have symptoms or those people who also are at risk. And that's why we're emphasizing. It doesn't matter if you have any sign or any symptom, as we said, you need to be checked so that you know your blood pressure. If it's normal, you maintain at that. If it's abnormal, then you get assistance to modify it, because we say it is one of the modifiable risk factors. Well-person services. This where we are also recommending regular screening and guidance of people with no signs of hypertension. What do we mean here? If somebody has normal blood pressure, then it's our role also to guide and advise that particular person. How do you maintain that normal blood pressure? And this is what we are encouraging of lifestyle changes. Of course, what will involve is the full risk assessment. There are those people who are at risk. If you know that you're overweight or obese, then that puts you at risk of developing high blood pressure. So definitely interventions towards that are very important. Anthropometric measurements, that's BMI, and dietary habit assessments, among others. Then the community and environmental support, which actually supports most of the intervention that we are talking of. Screening of people with symptoms at risk for early diagnosis. Perhaps I would emphasize here, early diagnosis or early detection of high blood pressure will be very important, because when somebody presents with complications that I have just mentioned, then the management also becomes complicated and more elaborated. Medical checkups routinely, timely treatment and adherence to treatment, and again, behavioral modification and addiction support services. Tobacco use, alcohol use sometimes leads to addiction. So supporting these addiction services also contributes highly to reduction of high blood pressure in a way. What has been done so far? There are strategies that have been put in place, a health promotion strategic plan, which is in final stages. And what we are doing is to mainstream health promotion service delivery, and also bring the concept of intersectorial and multi-sectorial collaboration to address social determinants of health, and for that case also NCD. Then we have a planned step survey, which perhaps will guide us and tell us more about the magnitude of risk factors in this country. But again, we ask ourselves, what will be our role in reducing the prevalence and the risks and other complications that are related with high blood pressure. We all have a duty to strengthen the policies we have on health promotion and NCDs, again, because we said most of the risk factors that cut across most of the non-communicable diseases, they are shared. But for this case, they are also specific to high blood pressure. Mainstream well-person services in the health delivery system. We need to encourage our people, we need to encourage our friends, our relatives, our parents to get well-person medical checkup, so that some of these parameter blood pressures are picked on time, and the treatment or any other intervention is put on place. We have a role also to advocate and increase awareness on the risk factors of high blood pressure, as I have mentioned. Capacity development, not just as a routine way of taking blood pressure. We need to go beyond the taking of blood pressure and taking task ahead of us to advise our clients, our people, on what to do to maintain the best blood pressures and also other issues. Then the concept of multi and intersectorial collaboration approach. From my presentation, I think it's very clear that we need to work as in a multi-sectoral approach if we have to really win this fight against high blood pressure and other risk factors. Research and surveillance, that is to promote our validity and availability of our data, and prioritize NCD prevention in the new governance system. We need the NCD agenda where some of these risk factors, high blood pressure, tobacco use, and the rest are embraced by the new governance systems. With that, I would say thank you, and I would say measure your blood pressure, reduce your risk.
Let me join the previous speakers in welcoming you all to this very important function, the commemoration of the World Health Day 2013. Let me remind you that the 7th April, we are a bit late for good reasons. The World Health Day is the 7th April. The 7th April marks the anniversary of the World Health Organization. It was the 7th April 1948 that the World Health Assembly constituted the World Health Organization. And at the same time, they declared the World Health Day. So we are now, as an organization, 65 years old. So we use this opportunity not only to celebrate our birthday as an organization, but also we use the day to take out messages. We use the opportunity to advocate around a common health theme. So every year there is a theme, and the theme for this year's commemoration, as we have heard from the previous presentations, is about hypertension, is about high blood pressure, is about damu kwa juu. Which is really becoming a public health problem, more and more a global concern. Ladies and gentlemen,